Most people think healthcare is expensive because medicine is advanced. They don't. I'm Dr. BenMaamer, board certified general and vascular surgeon, and I see what happens when competition disappears. This is not about blaming hospital or insurers, it's about understanding incentives. So, what people think, what the what is the common belief? Prices rise because technology improves. Doctors drive costs. Bigger systems mean efficiency. Insurance protects patient, and that sounds logical. But remember this, market concentration changes incentives. So, what actually happens? Hospital consolidation since 2000. Over 1,600 hospital mergers. By 2027, 5% of US hospital markets classified as highly concentrated. Market concentration is measured by an index, and that index, if it's higher, it means less competition. So when one hospital controls a region, negotiation leverage increases. Commercial prices rise. You know what studies show? That the hospital mergers increase price 60 to 20% on average. Some markets saw increase by 30%. How about vertical integration? In 2012, quarter 20% of physicians employed by hospital. By 2022, half, 50% are employed or system affiliated. And when hospitals own outpatient clinics, you know what happens? Facility fees added. Identical services cost more, and dependent practices decline. Patients often pay 2 to 3 times more for the same outpatient service under hospital ownership. 3. Insurance consolidation. In many states, one or two insurers control over 60% of market share. Commercial insurance prices are negotiated. Medicare prices are fixed. Price increases are most visible in commercial plans. When both sides consolidate, hospitals gain leverage, insurers gain leverage, and independent providers shrink. Patient choice narrows. So it's obvious why it gets missed. Patients don't see negotiation tables. What they see? Rising premiums, rising deductibles, narrow networks, surprise facility fee. You know, the other overlooked reality. You know, the United States healthcare spent between 17 and 18% of GDP. The OECD countries, they are only around 10%. The difference isn't utilization, it's the prices per service. And this is the part nobody likes to talk about. When competition decreases, prices do not fall. So what are the consequences? System level impact, higher negotiated commercial rates, less price transparency, fewer independent hospitals. Over 140 rural hospitals closed since 2010, reduced local access. Patient level impact now, higher out-of-pocket costs, higher employer premium, cost shifting to employee, reduced provider choice. Consolidation, yes, can improve coordination, but evidence shows price increases frequently outweigh efficiency gain. Don't forget that. So, what can be done? Policy level levers. Stronger antitrust enforcement, site neutral payment reform, enforce price transparency, supporting independent practice sustainability, aligning reimbursement with outcomes. At the level of the patient, patient level action. Ask about facility fees. Compare outpatient centers. Seek second opinion. Request cost estimated before procedure. Competition drives value. Reduce competition shifts power. So, what are my recommendations? Don't assume higher cost means better care. Don't skip second opinion. Don't ignore billing breakdowns. Seek clarity before commitment. You know, when competition declines, price rise. That's economic, not ideology. And if you believe healthcare in America needs to change, hit follow. We are building momentum one video at a time.